What is ESR in lupus blood tests? Imagine trying to piece together a puzzle where some pieces keep changing shape. That's what diagnosing lupus can feel like. One of the tests doctors use is called the erythrocyte sedimentation rate, or ESR. But what exactly does it tell us? ESR measures how quickly red blood cells settle at the bottom of a test tube over 1 hour. When there is inflammation in the body, the red blood cells tend to clump together and settle faster. So a higher ESR can indicate inflammation, which is common in lupus. However, it's important to know that ESR is not specific to lupus. Many conditions that cause inflammation, like infections or other autoimmune diseases, can also raise ESR levels. In lupus, ESR can be elevated during active flare-ups when symptoms like joint pain, skin rashes, or fatigue worsen. But it can also be normal when the disease is in remission. Because of this, ESR is used alongside other tests rather than as a standalone diagnostic tool. Lupus is a complex autoimmune disease where the immune system mistakenly attacks healthy tissues. Its symptoms can vary widely and include fatigue, joint pain, skin rashes, especially the butterfly-shaped rash across the cheeks, and mouth sores. Blood abnormalities, such as low blood cell counts, are also common. Since symptoms can come and go and mimic other illnesses, doctors relying on a combination of clinical evaluation, medical history, and multiple laboratory tests to diagnose lupus. When doctors suspect lupus, they often order tests like antinuclear antibody tests, which are usually positive in lupus patients, and specific antibody panels. ESR can help provide additional information about the level of inflammation but cannot confirm lupus on its own. It is a supportive test that helps rheumatologists monitor disease activity over time. Diagnosing lupus is challenging because no single test can definitively identify it. Instead, doctors look for a pattern of symptoms and lab results that fit established criteria. They also rule out other conditions that might cause similar signs. Because lupus symptoms can fluctuate, regular testing and careful clinical judgment are essential for managing the disease effectively. In summary, ESR in lupus blood tests helps gauge the presence and degree of inflammation but must be interpreted within the broader context of other tests and clinical findings. If you or someone you know is undergoing testing for lupus, it's important to work closely with healthcare professionals who can interpret these results accurately. Always seek personalized medical advice for diagnosis and treatment options.